All right, okay. Yes, what's happening to you, Mark? Okay, anyway, all right. Shake. All right. Okay, so hello, dears. Ayan, hello, good day, good day. Welcome to another pre-recorded lecture in our class in Immunology and Serology. And for this lecture, what we're going to discuss now is your cold agglutinins. Ayan, okay. So, again, I hope you're all doing fine. I hope you're all doing fine, no? Sana naman. I think we're in the middle of the semester now. We're also in the middle now of our activities in IS. No, paspas yung kaayo. Paspas kayo on time, no? And medyo medyo senti, charot. So it's March already, birth month. Yes, okay. But again, it's not a fun month usually sa ako ang March. Kahit birth month na ako, no? Kaya dagan ko mga gipagdaanan sa March for the past years. So, sige lang, laban lang yun punta. So, din ako mo-expect na this year po, tsada akong March. But sige na lang, alright. Anyway, and yes, I have a new hair, char. Yes, kay Gibulagan, charot. To commemorate my 1 year of Maoy, charot. 1 year of moving on. Anyway, alright, so again, daming chika, Mark. These are your cold agglutinins. Ayan, so we're going to discuss now, we're going to focus on being cold. Ayan, mga convo nyo ni Crush. Charot. Yes. We'll focus on the life of Elsa. Yes, of Frozen. Frozen 2 is the best, diba? I don't make the rules, but yes, show yourself the best. Huwag kasi mo gipang chika. Oy, daganan akong chika. Anyway, alright. So again, these are cold agglutinins. Okay, so by the name itself, agglutinins. So these are, again, your antibodies that can agglutinate. And since cold man, so what does it mean? During cold temperatures or during mga cold environment. Okay, so mga convo nyo ni Crush dyan, okay, kung cold na, nako, watch out for cold agglutinins. Baka mag-agglutinate yan. Okay, alright, ayan, sige. So again, these are your cold agglutinins. Alright, so just some terminologies, no? Yan, I like the color talaga, color scheme, very malamig. Okay, so si Elsa ni siya. Okay, we'll focus on Elsa. Okay, alright, sorry. Kato si teacher na tigtudlo o ano ba, song sa Disney. The best dito siya. The best. Okay. Alright, anyway. Alright, so again, some terminologies. Daganan akong chika. Okay. Alright, again, for the word agglutinins, again, they refer to your antibodies that are capable of causing, by the name itself, agglutination. Okay? Nasa pangalan na. Agglutinins, agglutination. So these are antibodies, okay, that are capable of causing agglutination. Next, we have autoantibody. Again, it's an antibody against your self-antigens. Diba? You have been introduced to these terms, no? To this term, rather, in our lecture on rheumatoid factor, rheumatoid arthritis. Diba? So, because rheumatoid arthritis has autoantibodies. Okay, when you say, again, autoantibodies or autoimmune, these are immune responses, antibodies that are against, no? Or that are targeting your self-antigens. Why? Because again, your immune system cannot differentiate between self and non-self antigens. So, bahalag kung siya na antigens, bahalag normally occurring na siya in the body, dili siya makakause of disease, iyahang atakihon, di ba? So, which is not the case, di ba? That happens during our autoimmune states, di ba? Atong autoimmune diseases. Alright? So, again, autoantibody. And cold agglutinins, by the name itself, these are autoantibodies. So, most of your cold agglutinins, these are autoantibodies that can react below 30 degrees Celsius, causing agglutination of your RBCs. Okay. Alright. So, by the name itself, cold agglutinins. Ayan. And IgM usually is the antibody class that best reacts at temperatures below 37 degrees Celsius, and they're also termed as your cold antibodies, diba? So, recall, IgM good usually, guys, the optimal reactivity of your IgM is at about 4 degrees Celsius. So, ang IgM good ang malamig. Nasa pangalan na, malamig. So, they like cold temperatures. So, ganun yung mga cold. Ayan. So, cold ka ba? Charot. Okay. And usually, your IgG, siya ang mo react at your body temperature. Diba? 37 degrees Celsius. Okay. So, these are mga characteristics of your antibodies that are in terms of their reactivity at different temperatures. And usually, these are important. You are looking into the temperature activity or reactivity of your antibodies. They are very much important when you go to blood banking. Okay? Alright. Actually, important din sa IS, pero more on blood banking because especially during cross-matching, especially during mga antibody screening, this is one of the characteristics that is being looked at. Okay? that is determined, that is being used to determine, okay, the antibody that you are identifying in your cross-matching or antibody screen. Yes, laban lang blood bank. Okay? Yeah, usually this is really important in blood banking. All right, okay. But again, since we're talking about what's happening? Since we're talking about cold agglutinins, yes, so that's why we talked about IgM, optimal reactivity niya, less than 37 degrees Celsius, specifically mga 4 degrees Celsius, so really cold. All right, okay. Now we go now to the clinical significance of your cold agglutinins. Why are we talking about this? Because the cold agglutinins can interfere with your automated hematology analyzers. Okay, now recall that your cold agglutinins can react at 37 degrees Celsius below. So meaning it can react at room temperature. Okay, now when it affects your hematology analyzers, it can result to a decrease in RBC count, an increase in MCV, an increase in MCHC. Ayan, so basically because these are cold agglutinins. By the name itself, agglutinins. So at room temperature or at temperatures less than 37 degrees Celsius, which is our room temperature, so most of our specimens are processed at room temperature, di ba? Example sa imong hematology ng mga samples. So what happens, if na ay cold autoantibody or a cold agglutinin found in the sample, it can agglutinate the RBCs. So what happens, so ang mga RBCs mo, nagkumpul na, di ba? Ayan. So example like that. Alright? Now, kanisya, once it passes through your hematology analyzer, automated, this will not be counted as individual RBCs. This will only be counted as one. Okay? So as one. We heal as one. Charot. Okay? It will be counted as one. That is why your RBC count will decrease. Okay? Nagets lang. Aside from that, MCV, di ba? Your MCV is the volume of your RBCs. So therefore, ang makount ana is kanis lang tanan, so it's still also increased. And aside from that, MCH then, since it is counted as 1, so ang hemoglobin sa kada individual cell, makount po as 1, so mas mutaas. Alright? Okay, so I hope na-gets lang why in ani ang results. And I hope makorrelate lang. Diba? So as you can see, interconnected good ang field sa medtech, guys. So what happens in IS also happens in HEMA. In HEMA, blood bank. IS, blood bank. As in, like, connected na na silang tanan. And then, so sa iyo tapos sa HEMA, makitaan po sa mong clean chem. O, diba? So, dami. They are all interconnected. So, at least it's important, again, I think I have mentioned this siguro sa first sem pa, sa akong classes, or maybe sa ato ang recent lectures, no? Previous lectures na. It's important that you know to correlate. You know to correlate. Because again, the fields of medtech are interconnected. Okay? So, what you see in this subject, you can also see in this subject. Or what is expected from this, like HEMA, what is expected from HEMA, correlate po ka with IS, parang ganun. Or what can you see in Clin Chem, you correlate with Clin Mic, parang ganun. Okay, so they are all interconnected. Small world. Huh? Small world? Yes. We are one. Huh? Mark, what's happening to you? All right, anyway, so that's our dilemma. Why is it also important? And our corrective measures, since of course they react best at temperatures greater than 37 degrees Celsius, of course, to correct this, we warm or wash your sample, and then we warm that to 37 degrees Celsius, and then we will run the test. Okay? Because again, that would hold or that would make the cold agglutinin inactive. So, di na siya ka-agglutinate sa mong RBCs. Alright? Okay. Ayan. Aside from that, your clinical significance, your cold agglutinins, they are mostly insignificant. Okay? Mostly clinically insignificant sila, meaning they don't cause any disease. Apart lang atong error na pwede niya ma-cause sa imong hematology analyzers. Okay? So, mutuyahang mga parang disadvantage or downside. But aside from that, no, they don't normally clinically cause disease. Okay? But some have the potential to cause autoimmune hemolytic anemia. Okay? And this can be a problem in patients that undergo open heart surgery or surgery that lowers the temperature of the body. Example, open heart surgery. Okay? Alright. Ayan. And again, may be benign or pathologic. Okay? But most of the time, they are benign. Okay? So they do not cause any disease. Alright. Okay. Now we go now to the different characteristics of your cold autoantibodies or cold agglutinins. So between benign and your pathologic. So for benign, as you can see, the thermal range is just again, mas cold, okay? Less than equal 20 to 24 degrees Celsius, all right? Whereas for your pathological, it can go beyond 30 degrees Celsius. So your pathological cold autoantibodies, they can react even greater than 30 degrees Celsius. So that's why it's really pathological. Because mo-react siya, pwede siya mo-react at cold, pwede po siya mo-react even at higher than 30 degrees Celsius. So it can cause really significant disease. Okay? Kaya pwede siya go beyond 30. For titer at 4 degrees Celsius, as you can see, less than equal to 64, whereas for pathological, greater than equal to 1,000. So there you can see na iya yung optimal reactivity, meaning the temperature na ganahan jud kayo siya or that mo work siya properly is at 4 degrees Celsius. Okay, but it can also react even at greater than 30. So at 4 degrees Celsius pa lang, taas kaya ang titer, di ba? Taas kaya ang concentration, 1,000. So grabe, intense. Okay, all right. Reactivity, it's normal, marginally enhanced with albumin. Pathological, strongly enhanced albumin. Strongly enhanced with albumin. So if you add albumin, so mas mo enhance ang antibody. Okay, mas mo enhance iyahang effect. Okay? Next, common specificity, what are these antibodies? You have anti-big I or anti-IH. That's normal. And for common specificity, pathological, anti-IRA. So your anti-big I can be both normal or pathologic. Capable of binding complement, both of them, yes. But for in vitro lang, ang normal. And as you can see, iyahang reaction is quite less, okay? Or it's not that strong. Whereas for pathological, in vivo siya mo complement bind. So therefore, inside your body, na complement binding na naitabo. And di ba, unsa may ultimate goal sa complement system? Lysis of cells. So once na complement fixation na hitabo inside your body, it then leads to lysis of cells. All right? And as you can see, that is, or direct antiglobulin test, yes, mas taas siya o reactivity, positive, strongly positive, due to, again, still the same C3. And for clinically significant associated with disease, of course, pathological lang, nara sa name, okay? And usually, your pathological cold autoantibodies, they result following, or they are only secondary to usually mga viral infections or with Mycoplasma pneumoniae. Ayan, so may mga bacteria pa rin, di ba? So interconnected talaga ang medtech fields. Ayan, so either secondary to viral infections or M. pneumoniae. Mycoplasma pneumoniae. Ayan, okay. All right, so those are some characteristics. Okay. Now we start first with your benign. By the name itself, benign. They're observed in even some healthy individuals. Optimal reactivity, again, based sa table, it's really 4 degrees Celsius. But occasionally lang at room temperature, 20 to 24 degrees Celsius. Titer, again, is less than 64, less than equal to 64. And usually, it's of the IgM class. Because again, di ba, optimal reactivity is 4 degrees Celsius. May interfere, this is one of its disadvantages or very mga nuance, no? It can interfere with your ABO blood typing, cross-matching, and AHG Coombs test. So as you can see, these tests, they are all utilizing antibody-antigen reactions. So since naman kay cold autoantibody, so pwede siyang mo-interact, no? Or mo-interfere with your tests. Okay? Alright. And these tests, usually, they are performed at room temperature, no? Aside from your cross-matching na daghang mga stages. And also your AHG, na siya different stages. Yeah. Okay, na mo use of different temperatures. All right? But again, the point is it can interfere. Because again, this is an antibody. And these tests, they test your antigen-antibody reaction. So, pwede siyang mo-apil-apil. Yes, pabibo siya. Joiner, ganun. Okay? All right. Ayan. Okay. Now, corrective measure as mentioned, we heat the sample to 37 degrees Celsius and then we run the test. Or if wala pa nahitabo ang test, we heat it prior to testing. We heat the sample prior to testing. Because again, that would that would inactivate your cold autoantibodies. Okay? And unsa din mga specificity? Anti-big I, anti-small I, anti-IH, anti-H, anti-PR, anti-GD, anti-SDX. And kanino siya ng mga antibodies, guys? You will encounter that in your blood banking. Again, these are antibodies to the different blood groups sa imuhang body. Okay? Anti-I of the I blood group. Yes. Anti-H is seen in your, I think sa ABO man Japan na. H antigen, yes. And anti-PR, anti-GD, anti-SDX, these are sa mga minor blood groups, if I'm not mistaken. So yes, blood bank, I'm not scaring you, ha? Pero marami talagang mga blood groups. It's not only ABO and RH, as in, you'll be shocked nadaghan kaayo. Alright? So, kalma lang, ready, prepare. Okay? Alright, ayan. So again, these are just some examples of the benign, okay, cold autoantibodies. And as mentioned, the determination of these antibodies are for academic purposes. So ato ang class, no, for determining lang na, okay, they exist, okay? These antibodies exist, all right? Okay. And again, most of them, they are clinically insignificant. So they do not cause any disease, all right? Okay. Now, in comparison, in contrast, pathologic by the name itself, it can cause different diseases. Number one, it can cause what we call cold heme disease or idiopathic cold AIHA. All right? So when you say idiopathic, you don't know the cause, diba? The meaning of idiopathic, you don't know the cause. You don't know me, Char. Okay. So unknown cause, idiopathic. All right? Okay. And AIHA, of course, is an autoimmune hemolytic anemia. All right? Okay, so it's a type of an autoimmune hemolytic anemia. Also, there are cold autoantibodies that are, again, secondary to infection after different infections, first caused by Mycoplasma pneumonia, caused by virus, infectious mononucleosis, familiar, yes, virology is waving, charot, okay. And, of course, paroxysmal cold hemoglobinuria or PCH. So we'll go into that later, individually, all right? Okay, ayan. All right. Now, we'll start first with your pathologic cold autoantibodies or cold agglutinins. The first disease that can be caused by these cold autoantibodies, your cold heme agglutinin disease. Now, this cold heme agglutinin disease is also known as, again, your idiopathic autohemolytic anemia, cold AIHA, and cold agglutinin disease. So, these are the other names. All right? It comprises about 18% of the cases of AIHA. So by the names of AIHA, autoimmune hemolytic anemia. So by the name itself, there are antibodies, autoantibodies that target your antigens, self-antigens, and they cause hemolysis. So they lyse your RBCs. All right? Now your autoimmune hemolytic anemia, it could be cold or warm, di ba? And most of the time, warm ang mas daghan og cases. Okay? Kaysa sa cold autoimmune, kaysa sa cold AIHA. All right? Okay, so I think you've discussed this in your anemia, Hema 2, yes? Okay, all right. Ayan, so baka review na lang, hopefully. All right, now cold AIHA, your cold heme agglutinin disease is a type of cold AIHA. Okay? All right. Ayan. Now, it can be mild, pwede po siya life-threatening, complement-mediated, intravascular hemolysis. Ayan, so we'll dissect the words, okay? Complement-mediated, by the name itself, it uses complement system. And intravascular lysis, within the blood vessels pa lang, nag-lyse ng RBCs. Okay, so what do you think happens or what do you think are the results? Mo-release of hemoglobin. It can cause hemoglobinuria, okay? It can cause hemolysis, of course, and bilirubinemia. So increase ang bilirubin because of excessive lysis of RBCs. Okay, sige. Alright, ayan. And again, unsay ang cause? It's a cold autoantibody that optimally reacts at 4 degrees Celsius, but it can also react between 25 and 30 degrees Celsius. So as you can see, wide range of temperature iyahang reactivity. Excuse me. That's why it can be pathologic. Alright. Antibodies, usually IgM, and kinsa di sila namang IgM, it's always anti-big I, common others anti-small I, and rarely anti-PR. So kabantay mo sila gyapon tong nakita nato na benign. So they can also be pathologic. Okay, and usually they are pathologic after an infection. So after secondary to an infection like viral infection, Mycoplasma pneumonia, yes, ganun na infection. All right. Okay, and kanisha guys, it means basta C prime, okay? C na naay apostrophe, that means complement. Okay? All right. Nalimot kong share sa ato ang lecture on complement fixation. But yeah, C prime is complement. Okay. All right. Ayan. Okay. Now, for the pathogenesis of cold heme agglutinin disease, okay, let's say your patient has a cold autoantibody. All right. Okay. And this patient is now exposed at temperatures less than 30, di ba? 24 to 30, 28 degrees Celsius in the extremity. So usually mga hands. All right. Now, what happens is the autoantibody binds to the RBCs and agglutinates them. All right. And as they pass through the skin capillaries. So sa skin, because your skin usually mas close siya to the surface, so mas exposed siya to the outside temperature. Therefore, pwede siyang cold ang temperature dito. Alright? So, it's optimal for the autoantibody to react. So the autoantibody agglutinate the RBCs as they pass through the skin of the capillaries. Okay, capillaries of the skin capillaries. Okay, and then what happened? Two things can happen because of antigen-antibody agglutination, di ba? It triggers your complement system. So what happens is complement attaches to your antigen-antibody reaction. It then results to intravascular, extravascular hemolysis. Okay, and aside from that, localized blood stasis because na may mga agglutination na hitabo sa imuhang capillaries. Okay? So what happens, wala na blood na makapunta or makasulod because na block sa imong blood vessels. Alright? Ito mga agglutinates. Alright? So what happens, na ay acrocyanosis. So what happens, mang-blue imuhang mga extremities, imong mga fingers. Because again, wala na blood na muadto dito because of the agglutinates na nitapot, okay, or naaya sa sulod sa blood vessels, sa capillaries. Okay? And again, complement leads to lysis. Intravascular, meaning within the blood vessels palang daan, nag-lyse na daan, or extravascular, meaning macrophages in the spleen, okay, sila ang kaon, okay, or mu hemolyze sa imong mga RBCs. Alright? Okay, extravascular, meaning outside of the blood vessels. Alright, okay. But your intravascular hemolysis is not associated with fever, chills, or acute renal insufficiency, which can be seen for PCH, your paroxysmal cold hemoglobinuria later. Okay, which again another pathological disease. Okay, all right. Okay, so that's the pathogenesis of your CHD. Okay. And for clinical picture, usually, ang pinaka-target sa CHD are your oldies, okay? Ang mga gores, mga boomers, charot. Greater than 50 years old. And of course, by the name itself, it only happens during mga winter months or cold seasons, okay? Alright, ayan. And for clinical picture, ayan, as you can see, these are your acrocyanosis because again, the agglutinates are trapped within the blood vessels. So wala na yung blood na mo flow to the extremities, therefore, mo blue siya, mo cyanosis, okay? Acrocyanosis. And this is known as your Raynaud's phenomenon, okay, or Raynaud's disease. Pain and tinge and bluish tinge in the fingertips and toes as a result of vasospasm. Because again, wala na blood na makaadto sa imong extremities because of the agglutinates that are trapped within the blood vessels. Okay? Alright, ayan. Ayan, so weakness, pallure, and weight loss, similar to symptoms of chronic anemia, and hepatosplenomegaly. So, mo-increase imong liver and imuhang spleen because, again, of increased lysis of RBCs. So, increased workload to the spleen to accompany or to accommodate the increased workload mo increase shug size. Okay? Alright. Ayan. And jaundice if too much. Okay? Because, again, of too much bilirubin. Diba? Because of too much hemoglobin na release. Okay. Now, for the next video, we'll continue with the lab findings of CHD, all right? And then to the rest of the diseases, okay? All right. Ayan. Again, medyo maliit na yung memory ko, so munang gapaspas. Medyo magbahin-bahin ta sa parts, okay? All right. So, I'll see you on the next video. All right.